I'll be reacting to why China is worried about plastic surgery. Oh wow, they had a Miss Plastic Surgery pageant. I don't know if we have an equivalent here.
Marked the country's growing acceptance towards going under the knife. All part of a cosmetic surgery boom, fueled by the country's burgeoning...
So back in 2004, they were still seeing a boom in plastic surgery, but in recent years, I think it's even accelerated more.
我认为这个比赛呢，它是把我们那种以前人呐都很避讳这种啊，你是做过整容的。
It's interesting that these women are at least being very forward about their plastic surgery experience. So I think they're almost in a way like celebrating the fact that women can decide, and men, to go under the knife and get procedures, and are, open to talking about it. And I think that is a commendable type of advance. It's better than getting it and then saying nothing and acting like it doesn't exist when in reality it does.
The market in China is...
China definitely is a place that can regulate things much more than what we're used to seeing here in the States. Singapore.
So I've been in China operating, working, teaching, and observing the changing trends for the last 17 years. And I will say that people have gotten a lot more bold in what they want to see for themselves.
Dr. Waffles Wu, who currently operates...
Yeah, I think a lot of people either don't know about potential complications because those are never disclosed to them by the clinic or doctor who's treating them, or they just choose to turn a blind eye.
...out of Singapore, has been a plastic surgeon for over 30 years. In 2006, he was appointed the honorary head of plastic surgery at a hospital in Hangzhou, where he trained surgeons. Over the years, he's seen China's industry grow not only in size, but also ambition.
20 years ago, it would have been the usual kind of double eyelid or maybe a little bit of a higher nasal bridge, and that would be it. They'd be happy with that. But with a lot of products and a lot of new techniques being available to the Chinese, they've gone into it full force. And so now they're into contouring the face, shaving the cheekbones, shaving the jawbones, doing their nose, their eyes.
And this seems to have been heralded in South Korea, where doing V-line surgery was, fairly routine and is still today. These, again, bigger procedures come with more risk, and that's something that everyone who is considering these procedures should at least entertain and factor into their decision-making.
Like many industries in China, technology and innovation over the last 2 decades have played a central role.
In early 2000, majority of the marketing was done offline, just sort of traditional advertising on the streets. But then it sort of gradually evolved onto Baidu, so more sort of on the internet browser search space. But then in the recent past few years, we've seen lots of vertical integrated mobile phone apps being advanced in the market.
Many of these apps that try to give you an idea, simulated version of what you might look like, are oftentimes not very accurate. And it falls on the surgeon, I think, to really give a much more realistic impression of what things might be. So it's okay to use as a starting point, but just booking your surgery after there's been a simulated version of it without really talking through your goals with the surgeon and really making sure that what this app has created is realistic is not a great idea.
Gengmei, which means more beautiful in Chinese, and So Young are just 2 of the many social networking platforms in China dedicated to cosmetic surgery.
I can't read this, but it's obviously saying it's perfect.
From connecting prospective patients to recommending nearby surgeons and even offering microloans to pay for the treatments, these apps are a one-stop shop for all things beauty.
Cute face. Great.
Within minutes of logging on, a user can book and pay for pretty much any treatment on the market.
Yeah, to me, that sounds a bit crazy, that you can just do everything through the app without actually talking to a doctor. And maybe there's a chat option, there, and that's the case, then I hope it's at least like a virtual video meeting with the doctor. But if it's literally like buying something off of, Amazon or whatever their version is, where you're just reading something and you can just pay for it without having to do a consultation and for them to even know your medical history or anything, that is really just flirting with danger.
And the sheer volume of information available has made the decision to go under the knife much easier. So Young has already been downloaded more than 400 million times in China since its launch in 2014.
Because of the internet and the way they advertise, of course, that knowledge becomes instantly available to anybody looking for plastic surgery. So it has really grown.
Yeah, what happens is people review before and after images, right? On any surgeon's website, on any app, and they pretty much come to expect that their results are going to look just like those. And I think it's important to keep in mind that usually people are putting up their best work. Some of that work from certain places, certain clinics might actually be computer, edited, and that can be dangerous because you might be expecting that, hey, you'll look like this person or this potential result, and then not get that at all.
Traditional surgery to give you a nasal bridge with a piece of silicone or a piece of Gore-Tex.
I hate silicone and Gore-Tex in the nose. The risk of infection is really high, and the risk of extrusion over time, over many years, is also really high. So personally, I try to avoid any of these sort of artificial materials in the nose.
With a syringe of filler, which you can just inject in the clinic, you can get a semblance of that improved projection and contouring of the nose. And that costs about 1/10, if not less.
And we have a video on nasal surgery versus nasal filler. So check that video out. And yeah, it's not the same thing, but yeah, I think I like the way that the surgeon said it. There is some semblance to maybe how things could look, especially with bridge augmentation.
So for somebody who's a little tight on budget, they would tend to do the non-surgical procedures, which are infinitely cheaper than the surgical procedures and with fewer complications.
Not necessarily, especially when we're talking about the nose and nasal filler. Doing injections into the nose actually carries some real risks, and that is because the filler can go inside of a blood vessel, and if it then connects up with one of the vessels for vision, you can get some vision loss. There can also be some areas of skin death on the nose as well. So in some ways, the risks of nasal filler can be higher than nasal surgery.
Eyelid surgery was one of the popular procedures. For one thing, it was quite affordable in comparison to a nose job. So it might cost just a couple $100, say about 1,000 Chinese yuan. This one-child policy, parents are quite willing to help their children to get started, at a very competitive society.
Yeah, I think competitiveness has a lot to do with the boom of plastic surgery. I think it's a way for people to stand out, for better or worse. And some people see that as gaining a competitive advantage in China and in the States and everywhere else.
Parents paying for this kind of simple surgery as a gift for graduation.
I have to remind people that there really is no such thing as simple surgery. Some patients have this idea that there are certain surgeries that are just easy. Certainly there are certain procedures that have many, many more steps than other surgeries, and they might be a bit less complicated, but to do a good job with even the simplest of surgeries requires a lot of skill and talent. And that's something that, I don't know, a lot of people don't talk about. It's just like, oh yeah, this is an easy surgery and this is a more difficult surgery. No, really, especially if you're talking about aesthetic surgery and especially if it's on the face, any procedure is complicated.
Some consumers hope that changing their face may change their fate in the country's highly competitive job market.
Today, you have to be beautiful to succeed.
We do have literature to support that more beautiful or attractive people tend to be more successful. There are studies out of Hopkins that I usually reference that speak to that. And so this isn't something that's like just only in somebody's mind. This is something real that's substantiated with data to show that the way that others perceive you and respond to you is quite different when you're perceived as more attractive than not.
In 2018, a Human Rights Watch report pointed to several job postings that openly specified requirements in gender and appearance.
Changing their aesthetic beauty, they can somehow enjoy some social advantages. Several people tell me that they can find a better job, for example, at the job market, or they feel that it's an investment in the sense that in the long term, they can get some kind of return. It's not so much about whether or not they like to have.
I think it's an uncomfortable thought and would be nice to believe didn't exist, but I think in many ways there's some truth to this whole concept.
Like many parts of the world, beauty standards are being set and exacerbated by the presence of influencer and celebrity culture.
They're constantly bombarding the internet.
And that's partly why we try to expose certain procedures that celebrities may have gotten. And it's because oftentimes people look up to these celebrities and influencers. And if they believe that, these people are totally, natural and never had any modifications, then that casts like a more self-critical view of themselves, because now they feel like, well, they can never get there.
In that space with images of what they think a beautiful face should be, and people therefore follow that and feel that that's what we should look like because everybody else is doing it, and all the influencers that have a certain kind of facial look. So this does rub off on the younger people, and it's exactly the same in China as it is in Singapore.
Yeah, and the latest trend with the buccal fat removal, we did some videos on it recently, and you can see, how much of a trend it is and how many of these influencers have gotten the surgery to look a certain way. And of course, that's then going to influence many other people to do the same or to, want to, get procedures done.
But the same influencers that help build the buzz have also fallen victim to its darker side.
Yeah, that looks pretty concerning. And you can see that she's having some signs of necrosis at the tip of her nose. And that could be because of how many procedures she's had on her nose where the vascularity of the nasal skin has decreased significantly. It could be because there was an implant that was placed into her nose that's now starting to be pushed out by the body because it was this artificial material. Lots of different things. Sometimes it's that's the filler injections that can bring this on.
China had over 80,000 unlicensed institutions in 2019,
Whoa.
accounting for about 84% of the market.
See, that's scary. And then we talk about hair transplants a lot on this channel, and Turkey comes up a lot, and Turkey is a place that people go to for more affordable hair transplants, and there are some great clinics there that do very nice work. However, there are many of these unlicensed clinics that probably also account for the majority of the market and really are dangerous places where people get botched and, really transformed into ways that they never wanted.
Plastic surgery is a very normal thing in China. Many young people will change something they're not very satisfied with. But I don't think beauty is everything, but confidence maybe can really take you some more better opportunities. But I think if you are not beautiful, but you are very confident and talented, the opportunity is also there for you.
Yeah, that's beautifully said. I don't think I could say it any better than what she just said. But I think plastic surgery, cosmetic plastic surgery is here to stay. I don't think we can just, sweep it under the rug and pretend that it's not there. It's always going to be there. It's just going to grow in popularity all around the world. And it's like, how do we best train doctors in it? How do we best relay the benefits and risks to patients and not just try to get them in, and try to get their money? And that usually isn't a good type of approach in the long run for individual clinics, definitely not for patients, and not for the industry as a whole. Yeah, I think now that we know that it's here to stay, we need to all collectively figure out a way to make it work for everybody so that it's used at the proper times when it can be most effective and not abused by anyone or in any specific place.